Should I look directly at the camera?
No.
You. Okay.
Yeah.
So my name is Robyn Stephenson. I am from Jamaica. I am a practicing physician, and I'm here studying a Master in Public Health at Imperial College London. Yeah. Well, I love the public health training programs here. I do think the UK and the NHS do one of the best jobs in the world. I'm probably biased, but one of the best jobs at managing public health on a day-to-day basis. I especially love the similarities between like the NHS and our system at home. The healthcare systems have a lot of overlaps, and I have just always liked the UK ever since I was a child. I have family here, so I had come when I was about 9 years old to see the sights, I guess. Very touristy visit, but I enjoyed it a lot, and I'm glad I came back. Yeah. Oh, I love public health. That's my passion. I am a primary care physician, primary care and HIV physician at home. And one of the things you quickly realize as a doctor is most of your patients' problems are not one patient problems, they're like population level problems. And so public health really gives you that population level perspective and overview, and also gives you a lot of skills to be able to start to think about tackling like those core underlying problems, like the social determinants of health and the reasons people actually do get sick. So if you think about like prevention, which is what primary care is supposed to do, like your GPs and stuff, public health kind of goes beyond that prevention, like takes it a step even further back to try and stop problems at a society level before they become a problem at the individual level. So yeah, that's why I decided to pursue public health. That is a good question. There are so many. Where to start? From a biomedical level, a lot of my lecturers were interested in like nutrition, so just, you know, rising rates of chronic diseases and aging population. From a system level, it's the NHS is so highly specialized and very fragmented, so that need for like reform and more joined up care. Vaccinations and vaccinations fall into COVID, but just that general communication with the public about risk and benefits and tailoring your messages to different audiences. And I feel like the UK is such a diverse population, and somehow they still haven't quite got it right how to talk to different groups of people. And so that's another big part of public health, that communication is huge. So, well, I guess those are my top three. Yeah. That's a good question. That's a tricky question to answer because it's been in lockdown mostly so far, so I haven't really got to experience London. But of the parts that I've like seen so far, I really love the green spaces. Like green spaces are always so accessible, just a park 5 minutes walk away, and that is incredible to me. I know I'm from like a tropical island where it's like, oh, but you have the beach, but it's not the same to have like a dedicated, well-maintained, really big expanse of green space where people just come and chill and hang out. So the parks definitely I have loved so far. Looking forward to exploring more. That is a fun question. I was Googling accommodations frantically, and like a bunch of people had met up with a letting agent who didn't seem like a very trustworthy person. So I was still trying to find stuff on the side, and I can't remember if it was a Google ad or Google just suggested, hey, you're looking for student accommodations, have you tried Victoria League Student House? And I was like, what is this? And then I clicked it, and it turned out to be absolutely perfect for my needs. So luckily I was under 30 still. And a Commonwealth student, and the hostel setup is kind of exactly what I wanted, because I did want to be around people, but not necessarily like in a self-contained flat. So that kind of built-in sense of community was something that I really liked. And then just the whole idea of having like a relatable house manager. Like Laura was really easy to talk to when I reached out to her, and just so well, that's how I found it, and and so I decided to pick it. my favorite thing about the student house is always having people around. And during lockdown, and I got to the student house right at the beginning of like the second lockdown, and then very quickly there was a third lockdown. So it's been really helpful having a sense of community, even when you're not like physically interacting with people, because sometimes you just don't see anybody for the whole like week or whatever. But just the idea of knowing that other people are around moving through the house, and you know, having like the house events, the potlucks and that kind of thing, that has been really, really helpful in like getting me to not feel isolated here in this new city, and that's been really cool.